family, it's Dr. Jade. We are chatting open enrollment secrets you must know. We're chatting open enrollment seasons you must know. Lean in, grab a pen. Those who are new here, I'm Dr. Jade. I'm the founder and medical director at Inspire Primary Care in Las Vegas. As you join, drop in the chat, where are you joining from? Are you in Vegas? Are you somewhere else? I want to know. Drop it below. Also, drop below what open enrollment questions do you have, because I'm bringing the secrets. You're going to want to know these things. I'm going to be honest, and we have solutions. So hold tight. People are already asking so many good questions this open enrollment season. You all asked me great questions in my stories. I've accumulated them into the top 5 things you must know this open enrollment season to help you make a educated, guided, well-informed choice on this super important decision that so many of us are making this season. All right. So drop in the chat. Where are you joining from? I'm joining live from Inspire Primary Care. If you're in the Las Vegas Valley and you've been looking for quality healthcare, you've been searching for a healthcare home, a team that knows you, that you can easily reach, Inspire Primary Care would love to be your healthcare home. You can reach us at 702-867-0017 if you want to learn more about us, or you can check out our website at inspireprimarycare.com. No I in front of Inspire. All right, y'all gonna drop in the chat where you joining from? I see you joining. All right, so let me know, where are you joining from? Is Vegas in the house or somewhere else? And let's chat the 5 things you must know this open enrollment season. For those of you who are like, wait, what's the open enrollment season? Okay. If you're new to adulting, then, open enrollment season is the time of year where we are making decisions on our health care, our health insurance. We're looking at plans. We're thinking about what is the best solution for my family, for myself, for my business, to help with quality and affordable health care options so that we can get the health care that we need when we need it, if we need it, right? And so those are the decisions we're making. That's open enrollment season, and it is upon us. All right, so we got Say It Mental Health says Las Vegas. So Las Vegas is in the house. Hello, as you join, drop in the chat where you're joining from. Any questions on open enrollment? Okay, grab your pen. Here we go. Top 5 things you must know this open enrollment season. It's good to see you all here in the chat. I see y'all. Okay, here we go. Number 1. Are you ready? All right. Premiums, this is no shock, but let me tell you the stats that go with it. All right. So premiums are rising. However, here's the secret that they don't want you to know. All right. The coverage inside these more expensive plans are actually shrinking, okay? This is important for us to lean into and understand as we look at different plans that sound good. The number they show us up front sounds okay, or it sounds expensive, but it's like, hey, I gotta get health insurance, gotta get good benefits or good coverage. It's important to know what these plans actually mean, and it's made to be complex and confusing on purpose. So we want to lean in and get informed on this together. All right. So premiums are increasing. The average of plans in Las Vegas are increasing by 12%. This is a huge increase, okay? Usually we see about an 8 to 10% increase annually regardless, just for inflation. But this year we are seeing an even more astronomical increase, around 12% on average for 2026. All right, this is gonna leave more Las Vegans uninsured or underinsured, and I'll talk about that later, what that means. But on average, most of us in 2025 are paying around $600 to $1,000+ a month for these insurance plans. We don't really know how to use it. We're avoiding using it, or we don't have any coverage at all. And this is going up by 12%. So it's important to make sure we understand what's in these plans, meaning what type of health care is in the plans. When you are going to see a doctor, how do you see a doctor? How soon can you see a doctor? What kind of copays? What kind of deductibles? What type of premiums? All of these things are important to know, not just this top line, this is what you'll pay monthly. There's so much more buried inside of that we really have to peel back like an onion and help make a decision like what's going to get us actual care when we need it, all right? So I need you to know, number 1 thing to know, you're going to be paying more for less within the new insurance plans. And so, we'll be talking about solutions here. What does that mean? What do I do? Well, how do I actually get a healthcare plan that's going to help me out? We'll chat about that, okay? So number 2 thing to know, as you join, I see more of you joining. Drop in the chat where you're joining from, okay? Las Vegas has already said they're in the house, okay? Number 2 thing to know this open enrollment season is that Primary care access in particular is shrinking inside of health insurance plans. So most of us, or some of us know, I shouldn't assume most of us know, but 90% of the healthcare needs you're going to have over the next year are going to be things that should be taken care of within the primary care office, meaning urgent care if something comes up all of a sudden, like a urinary tract infection or upper respiratory infection, any chronic care needs if you're diagnosed or have, type 2 diabetes, high blood pressure, high cholesterol, any in-office procedures, like if you cut yourself open while slicing, whatever at dinner, right? Laceration repairs, joint injections, like 90% of things that are going to come up for you in your health over this next year are going to be things that need to be or should be addressed in the primary care office. But the access to primary care inside insurance plans is shrinking even more in this upcoming year. Super important for us to know that. So the 90% of things that you are going to need cared for in health insurance plans is going to be either absent or more restricted or more difficult to access, okay? What that's going to look like is the average wait in Las Vegas is already 3 to 6 months. Insurance companies already automatically assign, on average, 3,000 people to each primary care physician or provider. So while you're trying to call your doctor, so are 3,000 other people trying to call that same doctor. This is how it works when you're assigned to a PCP through insurance, okay? So the average wait of 3 to 6 months may be increasing due to this, okay? The visits are required to be shorter, all right? Insurance-based physicians are required to get in and out of the room within 5 to 8 minutes because if they spend more time, then it slows down the whole insurance-based system, all right? This is going to lead to more doctors quitting, trying to find other jobs, trying to find jobs where they don't have to see 28 to 35 patients a day and cram these people in. They're exhausted, they're burnt out. So that means each time you try to see a doctor, you're going to call and then they're going to say, oh, that doctor doesn't work here anymore, but you can see this other doctor, which is going to decrease your continuity. It's all this chain event that leads to decreased quality care, okay? This is going to lead to more people, more of us going to urgent cares for things that we should just be able to go to our primary care doctor for, going to emergency rooms for things that should have just been addressed by primary care. It's all these downhill effects are going to take place because in these insurance plans that are more expensive actually are going to not only have decreased care across all specialties, but specifically across primary care. In Las Vegas, we're in a medical desert, not just a desert, but a medical desert. Very few primary care physicians or providers compared to the population, and this problem is going to be increasing in the new year, okay? So I know you're like, wait, none of this sounds good. What do I do about it? We'll get there. But these are the things we need to know, all right? Number 3 thing to know, lean in, all right? Lean in, all right? If you have questions as we go, drop them below. All right, number 3 thing to know this open enrollment season. There are going to be more surprise bills and hidden costs inside of these insurance plans, all right? So you're going to be thinking like, oh, okay, I'm already paying about 12% more on these monthly premiums. I already have these deductibles, but those deductibles are typically going to go up. So you have to pay more out of pocket before insurance will, quote unquote, kick in and pay for some things. You're going to have more claims that are going to, or prior authorizations. So there's going to be more tussling with the insurance company to cover things that they say that they will cover, okay? So those MRIs that you're requesting, those mammograms that you're requesting, those, x-rays or those CTs that you're requesting is going to be even more difficult to get those approved. And so people are either going to not get the care that they need or end up paying out of pocket cash pay for it anyway. So it's just important to know, and there's going to be more providers that are going to be considered out of network so that you can't see the doctors you want to see. So many things, but here's the one I really want you guys to understand. It's the hidden markups. So in addition to the bills you see, it's the bills you don't see, all right? It's the markups you don't see. And they're not required to tell you how much they mark things up, right? So when you go through insurance and you're like, oh my gosh, I only had to pay, $800 for something, but it only cost $40, And if you had paid cash pay through wholesale rates through a practice like Inspired Primary Care, you would have been getting the actual cost of that imaging, for example, instead of the cost with the insurance markups for something you've already paid premiums or met deductibles on, and you're still getting a markup. And this is on every service, okay? these insurance-based markups. The services, the supplies, the medications, everything you touch when you use it through an insurance company is marked up, okay? That is how their business works. And so if we understand how the system works, we can make an informed decision on how we want to operate with inside of this system. Are you following me? Are we tracking? I know insurance can be complex. It's not sexy. It's not, it can be boring, but I need us to lean into this because we don't want to go through 2026 and get to the end of the year and be like, what just happened? What just happened to my health? What just happened to my wallet? What am I missing? I'm letting you in on these secrets early so that we can make informed decisions this open enrollment season. You with me? All right. So that's the number 3 thing we need to know about the surprise bills, the hidden costs, the markups that are inside these quote unquote good insurance plans. All right. Number 4 of 5. Okay. We only have a top 5. I'm going to take a beat, take a little sip of water, drop in the chat where you're joining from. Do you have any open enrollment questions? I know I'm answering a lot of the ones you guys asked me in the chat, but drop any, all those that are live that I can see. All right. Drop any questions you have and we'll move on to number 4. All right. Y'all look quiet on me today. That's fine. No problem. Number 4. All right. Number 4 thing you need to know about open enrollment season. Okay. This one low-key breaks my heart. Not even low-key. Like, this actually was shocking when I saw this new statistic that came out. It is estimated that with the new pricing structure, legislative structure, insurance-based structure, the premiums and the rises in the cost that we are estimated to see is estimated to leave about 60,000 Las Vegas residents, only Las Vegas residents, 60,000 Las Vegas residents either uninsured or underinsured this new open enrollment season. This is a scary statistic, okay? This is the highest rate in decades that Las Vegas locals will become uninsured or underinsured. So this is so important for us to know what these insurance plans mean, what our healthcare needs are, what healthcare plans are actually going to help us address our healthcare needs or prevent needing healthcare, right? For those of us who are like, well, I'm healthy. Thank God I'm healthy. I don't need that. So we need to get established so that we stay healthy and are able to get on top of things early with a healthcare team that knows us well. Okay, we don't want to be reactive in our healthcare. We want to be proactive in our healthcare. All right. Okay, I'm off my my little soapbox there. But 60,000, you guys, are you shocked by this? Like I was. 60,000 Las Vegas residents are anticipated and estimated to either lose or downgrade their coverage in 2026 due to the prices, right? And so the other thing about this and that's contributing to this is employers are forced, small businesses, medium businesses are being forced to either not offer coverage or downgrade the type of coverage that they are offering to employees. So this isn't just affecting us as individuals, it's affecting employers as well to keep their doors open. So it's a huge effect on the full system. All right, so that's number 4 thing we need to know. There's a solution. I'm coming to the light at the end of the tunnel, okay? Number 5 thing to know this open enrollment season is new tax deductible healthcare options are now available. Okay, this is the one good thing out of the top 5 that I just said, okay? The legislation changes. There's a lot of them that are not going to affect people positively in this new season, but one that can affect many people positively is that the new legislation is now honoring concierge style practices, membership practices, or direct primary care practices like Inspire Primary Care are now HSA eligible. Okay, they are approved for HSA. So if you have a health savings account, which many people do, or many people could get one, okay, and is check with your CPA, check with your people, but highly recommended for most smart investments, okay, is to have an HSA account, and these pre-tax dollars can now be used towards concierge style practices. Okay, this is huge. The thing for employers, which is huge, if your employer offers a HSA, check out that plan this year. A lot of times people just go straight for the PPO or the HMO plan just because those are 3 letters that we're familiar with. People aren't as familiar with when the employer offers the HSA plan, but take a look at that one this year because now those pre-tax dollars can be used for higher quality care models like Inspire Primary Care. The other thing, if you are a business owner, lean in. You're going to want to join us December 12th for our Lunch and Learn here at Inspire Primary Care. I'm going to be giving the inside scoop for open enrollment season just for business owners. The business owner strategy that you need to know to be able to offer your employees higher quality care for less money, and it's a tax deductible way for your business to offer these benefits. You want to be there. The Eventbrite will be out soon for the business owners in Las Vegas to come to our Lunch and Learn December 12th. You're not going to want to miss it, okay? But for individuals who are watching this, you can utilize your HSA. Your employer can offer an HSA. You can select that plan and then use those pre-tax dollars towards an Inspire Primary Care membership if you're in Las Vegas, or a direct primary care concierge style membership if you're in another location outside of Las Vegas, okay? That one you need to know. Make a note of it. If you have no idea what I just said, just write it down and put it in ChatGPT. Look into it later. It's an important one, okay? All right, so I'm going to look. I see in the chat, all right, that Say It Mental Health says, my biggest concern is what happens if a catastrophic issue comes up. So this is such a good question. So this leads us to what is the solution? And I'm going to circle back and answer that, okay? So have you considered this open enrollment season? Concierge style practices, direct primary care practices, membership style practices. Don't let the name concierge scare you off into automatically thinking, oh, that's expensive. That's for rich people. That's for somebody else. No, that is not the case anymore. These plans and these practice models are now more affordable than ever. Here at Inspire Primary Care, for example, we have plans that fit all budgets, all lifestyles, all healthcare needs. We have our virtual option, we have our concierge option, our specialty option. You can literally look and say, well, what do I need? Well, do I only really need to text and email my doctor? Do I really just need my refills done? Well, maybe I should take the more affordable virtual plan. That one I can afford. So don't let price scare you or the name scare you, okay? Look into if these can actually provide you with a higher quality care, because many Las Vegas residents have already figured out that this is the better way, have joined Inspire Primary Care, and they're like, I'm never going back. So I want you to actually open your mind to the idea of how do I get quality health care this year? What can that look like for me and my family? And is Inspire Primary Care the right fit, okay? Or something else, like what is the right fit, all right? But if it's us, we'd love to care for you all. So circling back, so what does that look like when you say, okay, well, what do I get at Inspire Primary Care that I'm not gonna get from a traditional insurance plan? You're gonna get your same healthcare team an easy text message away, phone call away, email away. You're gonna get visits in office, via phone, via video. All right, doesn't matter where you are in the valley, your same healthcare team that knows you is at your fingertips, literally your healthcare home, okay? So if you've been looking for a healthcare team that knows you well and is actually accessible when you need us, you don't have to figure out, sit on the phone, trying to make an appointment. You just text your team. You just call your team, all right? You just email your team, and then we're ready for you, right? All right, so unlimited. People ask me this all the time. Well, is there a limit of how many texts, how many visits? Are there secret? No, there are no secret hidden bills or anything like that. It's unlimited healthcare. You can think of it like a gym membership, but for primary care. You use it as much or as little as you want. You think of it like Netflix, but for primary care. Costco, but for primary care, all right? And so 90% of your healthcare needs in one place. This is your healthcare home, your same team, your personal team. We're incentivized to help keep you healthy, all right? So we want you to be healthy. We want you to be medication free if that's safe for your organs. We want to help you prevent and reverse chronic disease. We want to help you transition to a healthier lifestyle and a healthier weight, right? We want to help keep you out of the emergency room, keep you out of the hospital, prevent you from needing the surgery, right? Discover your health screenings and do your health screenings early to try to prevent preventable cancers, right? So this is our goal. This is our mission, all right? So if you're getting these things through your health insurance, then great. If you are not getting these things through your health insurance, then don't just do the same old thing every single year, because we've been programmed to think that health insurance equals healthcare. And that is not the truth. Health insurance equals a plastic card that may or may not pay for things when you need it, where a healthcare team may or may not be accessible when you need it. All right. So let's think about this. All right. Let's peel it back and let's, lean into what health open enrollment season can actually look like this year. All right. So let me circle back to say it. Oh, drop in the chat, you guys. I see you guys joining. I see more from Las Vegas are joining. Drop in the chat if you're joining from somewhere else. And if you have any open enrollment questions, drop them below. But back to Say It Mental Health. So this circles me back to your question. All right. My biggest concern is what happens if the issue of catastrophic issue. So if you have a catastrophic issue that comes up, well, then what do I do now? The reason Say It Mental Health asks this question is because if you say, you know what, I want that kind of care, I want that type of healthcare home, let me join Inspire Primary Care. Our services are primary care services, which are 90% of your healthcare need. Urgent care need, chronic care need, preventive care need, in-office procedures, preventive screenings. That's what you're getting, right? 90% of your healthcare needs for a flat membership, right? But what about the 10% of care? What about the hospitalizations? What about the surgeries? What about if I actually do need to see a specialist, right? So then what happens? If you have insurance, you use insurance in those scenarios, just like with a car. With a car, you do not use your insurance when you need to go get gas in your car, when you need an oil change, when you need windshield wipers. You're not pulling out your car insurance. But when you get into a crash, a catastrophic event, you say, now I need my insurance. So it's not that Inspire Primary Care is saying don't use insurance at all. We're saying let's use insurance properly. Let's pair Inspire Primary Care with the healthcare plan that's going to properly fit the 10% of needs that fall outside of the primary care office. For many people, that may be a high deductible healthcare plan where the monthly premium is lower, the deductible is higher. It's meant to cover the high cost things that are like over $5,000, for example, like a surgery or a hospitalization. But the everyday needs, the 90% of things, are covered under our Inspire Primary Care membership. So it's more so being strategic about what type of insurance is appropriate for my individual needs or for the needs of your actual family, right? So that's one answer. Now, for those who don't have insurance for those 10% of needs, of course it's recommended, but if you don't have insurance for the 10% of needs that fall outside of the primary care office, the reason I said you can think of us like Costco is because for many of those needs that fall outside of our services, we have wholesale cash discounted rates on those things. For example, our medications, we do pharmacy coupons to get you the wholesale rates on all generic medications. We partner with the imaging centers directly for the wholesale rate without insurance markups on the mammograms, the x-rays $25, for example, the MRIs. We partner with the labs directly for the wholesale rates without the insurance company markups on your labs, right? So hemoglobin A1C is $6, the lipid panel $6, right? And so you can choose then, if you have insurance, to either see if it's more affordable to use your insurance, but most of our members who join that have insurance quickly find out that it's going to be more cost savings to use our discount wholesale rates without the insurance markups when they're a member of our practice. So the whole long story to that is we help you navigate a complicated system, and we help to make that system easy for you. All right, so you don't have to figure out like, oh, I have this, what cardiologist, or where do I go? That's what your healthcare home is for. We're here to do that. We're here to help you navigate the system and make it easy, all right? I hope that answers that question. I see you all joining. I have a couple minutes. If you have any questions, this is the time to drop it before I hop on off and see my next patient. But I want to summarize the top 5 things that you need to know this open enrollment season is that premiums are rising, the coverage inside of those health insurance plans are shrinking, the primary care access inside those plans are shrinking, all right? There are going to be more surprise bills and more hidden costs and more insurance markups than ever. This is going to be the highest rate of lost Vegans, 60,000 estimated to become uninsured or underinsured. And there is, the light at the end of the tunnel is, HSA plans are now a qualifier for practices like Inspire Primary Care. All right, so Inspire Primary Care, you can use your HSA, those pre-tax dollars, and it can actually be tax savings, a tax deduction for individuals and business owners. All right, so those are things to know. We don't need to just say, give me the same old plan, I'll take the price increase, whatever. It's not about that. You got to peel back the layer. We got to look deep, and we have to actually make a strategic choice that's going to help our families get healthier. All right, that's the only way we're going to improve health as a whole. If you have been thinking about joining Inspire Primary Care, if you have been stalking the page, if you've been looking at, the Instagram, the TikTok, the YouTube, and all the things, and you've been like, I heard my friend goes there, but I don't know. Concierge sounds fancy. Stop it. All right. Now is the time. Now is the time. If you've been thinking about it, mulling over it, action is the next step. All right. So open enrollment season is here. We've got an open enrollment special for you. Okay. The open enrollment special is anyone who joins our concierge annual membership for open enrollment season, we will take $400 off your annual membership. This is one of the biggest discounts we've ever done. But because 60,000 Las Vegas residents are anticipated to become underinsured or uninsured, we want to make sure that we're making healthcare, quality healthcare, easily accessible. We have created more flexible plans for you. So if the concierge plan is a little out of budget for you, we've created the virtual plan for you at a more affordable price point. So there really are no excuses this year to get high quality care. There are no excuses this year to not have Inspire Primary Care at your fingertips, okay? If you're a business owner, you're going to want to be at our Lunch and Learn December 12th. Be on the lookout. I'll be putting the Eventbrite up soon with the link, and seats will be limited. But if you're a business owner, you're going to want to know the inside tips for Las Vegas businesses, all right? I don't see any questions, you guys. I see Her Brand Elevate says, hi. Hello. And then Say It Mental Health says, thank you. It is my pleasure. It's my pleasure to answer your questions. I really just am passionate about Las Vegas residents getting high quality healthcare. This is my hometown, and I'm on a mission for us to improve the quality of healthcare access in my hometown. And that's what we're doing here at Inspire Primary Care. If this is the right fit for you, we would love to care for you. We would love for this to be your healthcare home. If it's not the right fit for you, that's okay. But who do you know that this is the right fit for? Who have you heard complaining about their healthcare, about their doctor, about their health, right? Who have you heard complaining about waiting 45 minutes, for a 5-minute, in the waiting room for a 5-minute visit? Like, who do you know that you're like, you know what? Let me send you, this Instagram page. Let me send you this live. Let me text you this number, right? Team Inspire is an easy text message away. We're at 702-867-0017. Our website is easy to maneuver. It's inspireprimarycare.com. No I in front of Inspire. There's a huge enroll button shaped like the Las Vegas sign right at the top. If you have more questions for yourselves that you just didn't want to, type here, you can DM us. Our team will check that. Or you can text our team, okay? If you text us the word open enrollment at 702-867-0017, you will get our open enrollment special. That's $400 off our annual concierge membership. We look forward to caring for you. I'll be on the lookout. I'll be watching. If you watch the replay, I'll look in the chat. And if you have any additional questions that come down, we will be doing like an open enrollment season over this next month. So keep dropping the questions. Keep DMing us the questions. Keep giving me the questions in the stories. And I will come back and do a part 2 of things we need to know this open enrollment season. I'll see you next time. Bye.